In 2012, really is when my journey started. Unfortunately, my sister suddenly passed away, and 13 days later, I consider it the impetus for what happened. I had a seizure. A meningioma, a brain tumor, was discovered. They are generally not malignant, but it's not a benign tumor because it does have, consequences. So in 2013, I started having shooting pains up my leg, and my left leg would give out, and I would also have like a sensation of like cold water being thrown on my leg. So, I would keep my neuro-oncologist, Dr. Glass at Jefferson, updated, and every time I would call, they would come down and I would have an MRI again, and they would say the tumor was stable, and, oh, it's some kind of neuropathy, it's not the tumor, and eventually the last two toes on my left foot became numb. I told Dr. Glass about it, and he said, oh, the tumor's not causing that, and kept complaining to my primary physician, and she sent me for an EMG, and it showed, at the time they called it benign fasciculations. It's where like you feel like you're actually like getting pings throughout your leg, and like twitches. And during the EMG, they asked me if I had leg weakness, which I did, and I asked them if I had ALS, and she said no. And I think what's confusing to all the doctors is that PLS generally only attacks one side of your body. For me, it's my left side, although my right is involved to a degree. So because it wasn't ascending on both sides, that's why they didn't think it was ALS. So I asked Dr. Glass, I called him up and I said, could you review the EMG? And he said, are you still having problems? And I said, every day. And he goes, oh, I think you need to come back to see me. So I had a joint neurosurgeon and neuro-oncologist appointment, and I showed Dr. Judy what my leg was incapable of, and he just said, it's not the tumor, it's something else going on. So ultimately that led to an appointment the day before Thanksgiving 2015. I will never forget meeting Dr. Rakocevic, one of the kindest, nicest doctors I've ever met in my life. And we had about a 2-hour appointment. It was Dr. Rakocevic and his other associate doctor, Dr. Pack, and I asked him if I had ALS, and he said, you have a motor neuron disease, but he said he didn't think it was ALS. Because all my research, trying to correlate the symptoms I was having with the brain tumor, everything just came up ALS. And I think at the time I didn't realize the different variations of motor neuron disease. So when I had the EMG on the right side and everyone had left the room except Dr. Rakocevic and myself, and he said that I had PLS, and I knew, because he had said, don't go home and Google anything after my first appointment, but too late, because that's what I do. I like to research, and so I just knew. I knew it was ALS, and I mean, a form of it, so. Well, I do take a variety of medications throughout the day. I take baclofen for the spasticity and the muscle stiffness, which has really helped because it's helped with my gait, being able to not have it. It just freezes up. It feels like you have like a blood pressure cuff around your leg, and it just like pumps up like so tight that you can't move. You feel like you have like wooden legs, and so that helps with that. I take gabapentin for the neuropathy. I have a lot of nerve pain in my leg, and especially my foot. And I take seizure medication for the brain tumor because I have had a couple additional seizures after the first one. And I do stretching. I have to elevate my leg throughout the day because what happens is, because the muscle's weak, the circulation is not functioning, so it gets swollen, and it just, to be elevated, to be in different positions is what